Hello, and welcome to the AMA's Steps Forward podcast series. We'll hear from healthcare leaders nationwide about real-world solutions to the challenges that practices are confronting today. Solutions that help put the joy back into medicine. AMA's Steps Forward program is open access and free to all at stepsforward.org.
Welcome to this brief episode in the AMA Steps Forward podcast series. This is your host, Dr. Kevin Hopkins, a family medicine doctor and physician director of health system engagement here at the AMA. Today, I'll share a quick pearl from our Steps Forward team. Being a physician is hard. The practice of medicine is hard. Perhaps, in some ways, harder than it's ever been. Yeah, we have way better communication and technology tools, and certainly superior diagnostic and treatment options than the, quote, good old days. But the stakes are higher. So are the expectations. And the workload and cognitive burden is enormous. I often say, if it was easy, anybody could do it. Work-life balance is hard for most professionals. Among physicians, though, it seems to be harder. Factors contributing to this likely include the nature of the people and the nature of our work. Physicians, by and large, have strong type A personalities. We're driven and ambitious. We wouldn't have made it here if we weren't. And if we're being honest, we physicians also have a tendency to be perfectionists who want to be in control, and we tend to show way more grace to others than we do to ourselves. These characteristics, along with a whole host of system setups, lead us to significantly higher rates of stress, exhaustion, and burnout among physicians compared with other professionals with similar education. Physicians with symptoms of burnout have higher rates of broken relationships and substance abuse. And while they're not the same, higher rates of burnout are associated with higher rates of depression and other mental health problems. Taken together, for some, the circumstances of our life and work are a real recipe for disaster. Did you know that on average in the U.S., a physician commits suicide every single day? Please, watch out for yourself and watch out for each other. Watch for symptoms of a larger problem, especially in those around you that you interact with regularly. These might include things like incomplete work, arriving late to work, missing during the day, not following through on obligations and commitments, maybe even comments from patients and staff about disinterest or lack of follow-through. Watch for changes in attitude or personality, both in yourself and those around you. Watch for social isolation and being more withdrawn. If you see something, please say something. For your colleagues and friends, and even acquaintances, ask how they're doing. If something seems wrong, it may well be. Show genuine concern, not judgment. You don't have to be an expert to offer to help. Peer support, feeling valued, and feeling supported by your coworkers is crucial to the well-being of colleagues and to reducing the risk of physician suicide. To reach the point where you take your own life, you must be feeling deep levels of desperation and hopelessness, where you come to the conclusion that it's the only logical thing you can do. Please, know for yourself and tell others that you and they are valued and cared for, and they're not alone. Get help for yourself. Offer to help others get the help that they need. Help reduce the risk of physician suicide. Mental health care is being destigmatized, and we can be a part of that good change. Check out the episode description for links to relevant tools and resources that can help.
Thank you for listening to this episode from the AMA's Steps Forward podcast series. AMA's Steps Forward program is open access and free to all at stepsforward.org. Steps Forward can help put the joy back into medicine by offering real-world solutions to the challenges that your practice is confronting today. We look forward to you joining us next time on the AMA's Steps Forward podcast series. stepsforward.org.